Officials tonight are changing recommendations on the number of H1N1 flu shots that small children need. The parents of healthy kids between the ages of 3 and 9 are being advised to get only one shot, but younger children still need 2 injections. That new policy comes as BC's provincial health officer believes the flu pandemic has peaked in British Columbia, and vaccination clinics across the island are seeing shorter lineups. A-News reporter Stephen Andrew joins us with the latest. Stephen.
Hudson, the number of people in BC hospitalized with the virus has remained steady for the last 2 weeks, and that has health officials cautiously hopeful infections are leveling off. Nurses in an H1N1 vaccination clinic in Esquimalt are a little more relaxed today. The pressure of long lineups and anxious patients has subsided, at least at this clinic, since the Vancouver Island Health Authority started issuing tickets. People now don't have to wait in a long lineup to get their flu shot.
I'd like you to take a big... No, you won't scream.
Vihar believes though some island clinics are still busy, most high-risk patients have now been vaccinated. That too could be leading to the lighter turnout. Changes to recommendations on who should get the H1N1 flu shots could help speed up the Canada-wide vaccination program. Health officials say parents of healthy children between the ages of 3 and 9 can assume for now they only need to get one half flu shot. The children aged 6 months to just under 3 years still need to get 2 injections. That information comes on the same day that a new poll has been released showing that 65% of Canadians believe that news organizations across the country have overreacted to the H1N1 pandemic.
I think they've been doing a good job on it, really. I don't have any problem with that.
Honestly, I hate to say it but in front of you like this, but I think it's a bit overblown. Like, we come out here and we just walk in.
Sometimes I see headlines that don't relate to the content of the article, but I wouldn't blame the reporters for that.
The province's medical health director says from the outset, health officials did not want to panic the public, but he cautions there is a risk of complacency. And it could be a reason some flu clinics are packed while others are underattended.
People's perception of risk can change drastically from week to week, as we saw 2 child deaths in Ontario and pictures of queues. That settles down a week later, people's adrenaline levels have gone down, they've made a different assessment of the risk and they're ready to wait or come forward.
And if attendance at flu clinics continues to drop off on Vancouver Island, health officials expect they will soon expand the eligibility criteria for people considered a lower risk. And it appears that the plan to have every Canadian vaccinated against H1N1 flu is not coming cheap. There are estimates, Hudson, that show the vaccination program could cost more than $2 billion. Meantime, BC's provincial health officer says if a good percentage of the population is vaccinated against the virus this fall, there may not be a third wave of the pandemic virus next spring.
All right, we'll see. Stephen, thank you.
You're welcome.